Hi, my name is Daniel Satchkov. I'm a co-founder and the chief data scientist at WellAI. We've had the strangest Thanksgiving in memory, at least in recent memory. And it looks like we're coming up on a Christmas season that is going to be equally unusual. And I'd like to talk about cheery and happy things today, but I really should talk about what we're seeing in the medical industry and in terms of people's health. What we're seeing is a lot of anxiety. People are afraid. The pandemic scares them. Over 70% of people say that they're afraid to visit a doctor. Planned procedures and surgeries get delayed, and so on and so forth. What are the effects of all this? Well, one effect is that people are feeling anxious. They don't know who to turn to. They're basically depressed, they're worried, and they don't feel like they have things under control. Second effect of this, we have not seen yet. Because people go to the doctor less, or the doctor is not as available, or there may be delay in various procedures that they take, what's going to happen is 12 months down the line, or 10 months down the line, or 14 months down the line, we're going to see serious health problems, unfortunately, if this continues as it is now, right? Employers will see very serious, maybe catastrophic health claims. And this is a big problem. Here at WellAI, we started developing our machine learning tools to help individuals with their health issues and to empower them before the COVID pandemic. But as it evolved, we're seeing more and more a need for tools that bring people peace of mind, bring medical knowledge to their fingertips, into their smartphones, so they can actually get answers and also connect them with doctors wherever they are. That's why we developed our WellAI digital assistant app. And I'll show you in a minute how it works. But before I show you the app, let's look at how people try to reduce anxiety right now. Let's say they're having a health problem, or one of their loved ones is having a health problem, and for some reason they can't get to a doctor. What they're going to do is they're going to Google the problem, or they are going to use a symptom checker, what's called a symptom checker, which are actually more or less the same thing. So when they Google a problem or use a symptom checker, what they do is enter their symptoms. Let's say, my back hurts, my stomach hurts, I have cough. They're going to get some results. It is very hard to make sense of these results. They're very disparate, and invariably some of these results are very dire. They're like terminal conditions. That does not help anybody, because they see some benign and mild things. They also see some very dangerous or terminal issues. That just puts them into a state of panic. At that point, their choice is, if they can't get to their physician, their choice is to go to the emergency room or get more and more worried. This does not help. Anxiety does not help with health issues. It makes them worse. So what do we offer as an alternative to patients and to employers who do not want to see their employees anxious, who do not want to see them unhappy, who do not want to see catastrophic health bills down the line? Well, we created this app. Let me show you how it works. It's a smartphone app. When I open it, it looks like that. I can actually talk to it. Hello?
Which symptoms are you experiencing, Daniil?
It's going to ask me what symptoms I'm experiencing. I woke up this morning and I have back pain.
Daniil, here are the symptoms I heard you experiencing. Backache. Is everything
So
correct?
the app recognized from that sentence, when I said I woke up this morning, I have back pain, it recognized the medical symptom. Yes.
Hold on. Daniil, I am researching your
Now it
case.
is researching the case. What it's doing is going
Also
through
experiencing joint
30
pain.
million medical studies. WellAI app has been trained on 30 million medical studies. It takes a first pass through a neural network, absorbs the symptoms, but now it doesn't stop there. It goes on to ask 12 to 18 very thorough questions to create a detailed assessment, and then based on the literature and the evidence in literature to come up with diagnostics. So right now it's asking me whether I have joint pain. Yes.
Do you also have joint stiffness?
And I can type or I can speak to it. Yes.
Do you have joint swelling?
No.
What about tingling sensation?
As you can see, this is a very thorough assessment. This is not your Google search. This is not a symptom checker. There are multiple neural networks that go through millions and millions of medical studies to come up with an answer.
Daniil, here are possible causes for your symptoms: atrophic, arthritis, bone loss, long-standing low back pain.
At this point, I have 3 possible results based on millions of medical studies, actually close to 30 million medical studies, all of PubMed. I can get recommendations from the app if things are not too serious. It'll tell me what to do if there is arthritis. But I also have the option to speak with a doctor. And this is where our app connects with the human aspect. Most people think of AI or machine learning as something that replaces human, that it's not humane. In fact, the goal of our app is to reduce the anxiety of the patient, but also provide the ability to speak with a doctor. But the key is, when I say, yes, I want to call a doctor, and I speak with the doctor is now able to see all of the results of the assessment, right? They don't have to ask all of the same questions. They don't have to go back and do the repetitive stuff they do all day long. This also reduces doctor burnout, and it allows the doctor to get to the human point, to get to the more in-depth questions that machine really cannot do. So if I call a doctor, there's a video call that puts me through a doctor if he or she is available. Obviously I'm not gonna bother a real doctor right now, but I'm testing this with our engineer, Max. Oh, there it is.
Hello,
so this Max, say hello. So instead of Max, this would be your doctor, or this would be a doctor on call, because we're also going to have, we also have a concept of Uber of doctors as opposed to Uber of cars. So you're able to hail a doctor, a qualified doctor who can help you reduce your anxiety if the digital assistant could not help with that. So imagine, bye Max.
Bye-bye.
Imagine what these things could do for your employees. I'm going to rate it 5 stars. Imagine what this could do for your employees. You're reducing anxiety. You're making them happier. You're reducing anxiety. You're making them happier. And you're setting yourself up to have far fewer claims down the line, because COVID could truly ruin your budget because of the catastrophic claims that will come down the line. We speak to many people in this industry, and they're all worried about the impact that this is having. Our app can help your employees be happier. We already talking to some companies who want to give this as a Christmas gift, as a New Year's gift, whatever holiday you celebrate. Check it out. Go to WellAI.health. WellAI, it's WellAI.health. Check out our app. For all employees that get this app, we're allowing their elderly parents to get this for free. This is really important because elderly have been disproportionately affected by this pandemic. So if you give an employee a gift of this app, reduce their anxiety, help with their health issues, and they're able to help their parents, this will do wonders for their morale. I believe we'll get through this period. We are resilient. Humans are resilient. And with the help of technology that doesn't replace humans but makes us more humane, we will pull through. Thank you.